Thank you for joining our webinar on the Addiction Treatment Program. I'm Kathy Yoakum, Criminal Justice Administrator, and your contact person for the ATP. Also joining us today is the Chief of the Criminal Justice Bureau, Chris Nicastro. Everyone is on listen-only mode today. This session is being recorded. All of the new expansion counties who have been recently awarded an ATP allocation have been invited to attend this webinar. So I will be providing a complete overview of the ATP, and we will leave plenty of time at the end for questions and answers. Please type in your questions in the question box, not the chat box. We will be addressing questions at the end of the presentation. You should also be able to see the handouts and print them if needed. There are two handouts. One is the PowerPoint, and the other one is the Treatment Services and Recovery Supports handout. We will also be posting a recording of the webinar and the presentation materials on the ATP webpage, which can be accessed by going to mha.ohio.gov, selecting the Treatment tab in the upper left-hand corner, and scrolling down to Criminal Justice and selecting Addiction Treatment Program. The Ohio Department of Mental Health and Addiction Services was given authority and funding to continue the ATP and to expand to additional counties throughout state fiscal year 2018 and 2019. This legislation was established in Section 337.70 of the amended Substitute House Bill number 49. The legislative language is on our ATP webpage. The ATP funds treatment and recovery supports for eligible clients that are enrolled in selected certified drug and family dependency courts. The funds are to be used to cover medication-assisted treatment, which includes FDA-approved long-acting antagonist therapy, such as Vivitrol, partial agonist therapy, such as Suboxone, or full agonist therapy, methadone. The funds may also be used to cover other treatment services, treatment for co-occurring mental health disorders, as well as time-limited recovery support. This slide reflects the counties that have been selected to participate in the addiction treatment program. Counties are separated by the fiscal year that they began participating in the ATP. The ATP started as a pilot program known as the ATPP in 5 counties in state fiscal year 2014 and 15. Case Western completed the evaluation of the pilot program. A report of their evaluation can be found on the ATP webpage. In state fiscal year 2016, the department was awarded funding to continue the program, and we implemented the ATP in 13 counties throughout Ohio. In state fiscal year 2017, the department was able to expand the program to an additional 9 counties, serving a total of 22 counties. The Treatment Research Institute was selected to complete an evaluation of the program throughout fiscal year 16 and 17. Earlier in fiscal year 18, we were given additional funding, which gave us the ability to expand to 9 counties. And then just recently, we went statewide with the addiction treatment program and added another 23 counties, of which those are participating today. There are 3 eligibility requirements to participate in the ATP. The client must be enrolled in one of the selected Supreme Court certified drug or family dependency courts. The client must also have an opioid or alcohol use disorder. And the client must be deemed eligible for medication-assisted treatment. However, the clients that are eligible for medication-assisted treatment may choose not to utilize MAT, but they can still participate in the program. The department was awarded a total of $16 million for fiscal year 18 and 19. That is $8 million per fiscal year. Funds are processed as an allocation and were recently distributed through our grants and funding management system, otherwise known as GFMS, to the county ADAMS boards. The funds flow through the ADAMS boards to the participating ATP treatment providers. Funds may be used for treatment and time-limited recovery supports for ATP clients as clinically appropriate, with no specific limit of how much ATP funds can be spent per client. Treatment providers may contract with outside agencies to fund services that a client needs, but they do not offer. For instance, if a client would benefit from a peer recovery support, however, the ATP provider does not offer that service, the provider may contract out with an agency that does offer this peer support recovery service and cover the cost of the service. ATP funds cannot be used for personnel costs of provider agencies. Recovery supports are defined as assistance that is intended to help an individual with addiction or mental health needs to initiate and sustain recovery. These services are typically not covered by insurance. Providers and courts should identify recovery support needs on an individual basis based upon clinical judgment and client need. Some examples of recovery supports include housing, such as recovery housing, short-term housing. This might include security deposits, rent, utilities, and these utilities and leases must be in the client's name, the ATP client's name. Transportation, these services such as bus passes, gas cards, cab or Uber fares. Identification such as driver's licenses, social security cards or birth certificates. Employment services such as job training and uniform. Emergency basic need items such as food vouchers, clothing vouchers, and hygiene products. Peer support services, support groups, and relapse prevention services. A case example might be a client is enrolling in a cosmetology school. ATP may help with paying for supplies required by the program, such as maybe a scissors, apron, etc. And then when the client graduates from cosmetology school, ATP may pay for the exam or license fee. Some of the unallowable expenses for ATP include college and trade school tuition, computer devices such as laptops, tablets, room and board at colleges, activity or lab fees, outstanding balances with the college or trade schools. Those are all examples of unallowable expenses. The legislative language now enables us to fund administrative costs for courts. I've sent out administrative funding allocation amounts by docket to each of the ADAP boards. The board then passes this specified amount to each docket. Administrative funds account for about 5% of the total 2018 funds, which amounts to $400,000. The funds were split up between the dockets based upon your estimate of your program participants. While the funds may be utilized at the court's discretion, the funds are intended to assist courts in serving more clients and covering staff time for collaboration with other agencies involved in the ATP. They could use it for time to do paperwork and other responsibilities related to serving ATP clients. Here is the ATP process. I want to review a typical process of how things should flow for clients who are eligible for the ATP. Please note that I do understand that each board, court, and treatment provider operates a bit differently and may develop different processes that work best for them. So on the left, you'll see the specialized docket process, where the court will identify those who are eligible for the ATP as new clients enter the docket. Note that if you are just now implementing the program into your docket, you will likely have clients that are already active in the court that are eligible. However, once you're further into the program, clients would hopefully be identified when they first enter so that they can start utilizing the funds as soon as possible. Court staff then have the eligible client sign a release of information, which includes our department, the Ohio Department of Medicaid, and the ATP provider, the treatment provider. Court staff will look up the clients in MITS to confirm Medicaid eligibility, determine which managed care provider provides their coverage, and inform the Medicaid managed care plan of their client's participation in the ATP. The specialized docket staff will then refer the client to one of the treatment providers selected to participate in the ATP. Note that other agencies that are not ATP providers will not have access to the funds. When referring the client for treatment, it is important that court staff inform the provider that the client is eligible for the ATP so that they can go ahead and use the funds for the treatment of the client. I have found that this process typically works best when there is open communication between the courts and the providers. Counties in which courts are working with the providers to help identify clients' need for recovery support seem to maximize the use of the funds and are able to better link clients with services that will assist in their recovery. If the client is uninsured, the treatment provider should be assisting the client in applying for Medicaid. ATP funds can cover treatment services until the client is enrolled in an insurance plan. Lastly, if the client is enrolled in a private insurance, ATP funds may cover copays for treatment. The ATP provider will then begin to identify treatment and recovery support needs of the ATP client and may utilize the ATP funds to cover the costs of those services. Note that as I mentioned previously, ATP providers may refer the client for additional support services not offered within their agency. So then that agency will contract with the outside agency to fund the services rendered with the ATP dollars. The legislative language requires the completion of an evaluation of the ATP. The 31 counties that have been a part of the ATP prior to the statewide expansion are currently participating in the evaluation. The 23 counties who have just been awarded and are participating in the webinar today will not be involved with the current evaluation. So if you are reading previous documents on our ATP webpage and they refer to an evaluation, you can disregard those sections. Quarterly reports. This slide discusses quarterly reports for the ATP, which I'll send out to each ATOM boards within the next few weeks. The reports are to be submitted quarterly to me via email by the ATOM boards and are due at the end of the following month after each quarter. The reporting will include the total number of clients served by each docket from the start of the fiscal year 19 through the end of the fiscal year, which will end June 30th, 2019. This will be an unduplicated client count. The reporting also includes the amount of funds used throughout each quarter. They are categorized by treatment services and recovery support services. This information will enable our department to better provide programmatic oversight, address any barriers to spending the funds by county, and also provide us with information to make more informed budgeting decisions in the future. I wanted to take a moment to briefly summarize the responsibilities of each party. Participating dockets should be selecting clients to participate in the ATP based upon the eligibility requirements, having eligible participants sign a release of information, sharing the release and other relevant documents to the provider, and providing updates regarding the client status to the treatment provider. The court staff will look up the client in MITS, which is the Medicaid's management technology system, to confirm Medicaid eligibility, determine which managed care plan provides their coverage, and then inform the managed care plan of the client's participation in the ATP. We will be providing a informative memo to the courts in regards to this process. That should be coming out within the next week. Treatment provider responsibilities. Participating treatment providers must be certified by the Ohio Department of Mental Health and Addiction Services. Treatment providers are responsible for utilizing an integrated service delivery model, conducting comprehensive diagnostic assessments, determining treatment needs, and developing treatment plans accordingly. Treatment providers should be providing clients access to medication-assisted treatment, other therapies for substance use disorders and any co-occurring disorders, and access to time-limited recovery supports. Providers should also be monitoring compliance through collaboration with the drug courts and assisting clients in applying for Medicaid. ATM boards will have all parties sign the MOU, one per county, and return it to the department. ATM boards are responsible for passing the ATP allocation to the treatment providers to cover the costs of recovery supports and treatment services. They will also be expected to pass a specified amount of funds to each participating specialized docket to fund administrative costs. The ATM boards will also need to complete and submit the ATP quarterly report. Collaboration between the board, providers, and courts will help this program run smoothly and tends to help counties maximize the use of the funds to best serve eligible clients. I also understand that each county operates a bit differently and will have a different process to run their program in a way that most efficiently suits their needs. If you have not already done so, courts and boards should be working together to identify ATP treatment providers to participate in the program. A process for identifying and referring appropriate individuals to participate in the program is vital so that treatment providers are aware that they are able to bill the ATP for services rendered. Communication about client needs is also helpful to ensure that available funds are able to be used to best support participating client needs. As always, appropriate releases of information and consent forms should be utilized in order to exchange information and maintain 42 CFR and HIPAA compliance. The Addiction Treatment Program Guide is a document that provides an overview of the process of the ATP the eligibility criteria, and the summary of fiscal year 18 programmatic changes that occurred at the beginning of this fiscal year that can be found on our website. The Recovery Supports and Treatment Services Guide is another informational document that provides examples and categories of recovery supports and treatment services that the ATP funds. This is also one of the handouts that I have attached to the webinar. The ATP quarterly report is to be completed and submitted by the ATM board each quarter. And the MOU, the Memorandum of Understanding, will be distributed for participating agencies' review and signatures. I have already received several of those back from the ATM boards. We also conducted an ATP survey and included all current participating ATM boards, behavioral health providers, and courts in an effort to assist the new and existing ATP counties with implementing the program. We hope to provide you with information on how ATP funds are generally utilized for treatment and recovery supports, with some ideas from our current ATP counties. We did just close that survey yesterday, and we will be posting a summary of the survey results. But let me just read some of those responses now. One of the questions that we asked is which behavioral health services have been provided utilizing the ATP funds? And the top answer for that was, of course, as the program was intended, for medication-assisted treatment. A large percentage also used the funds for assessment, counseling and therapy, residential services for their substance use disorder, crisis intervention, urinalysis, substance use disorder case management services, peer recovery support services, CPST services. And again, if the client has insurance, the insurance is to be billed first. These treatment services would be ones that are not covered by the insurance, or if it's an uninsured client. One of the other questions we asked on the survey is which recovery supports have been provided utilizing the ATP funds. Some of these responses in regards to the recovery supports are housing, transportation, childcare, and this would be childcare when the ATP client is attending probably either court or the treatment service. One of the other higher responses was for identification documents such as birth certificates and licenses, private insurance copays, support groups, relapse prevention, and emergency basic need items. Bus passes, clothing, employment services, food, gas cards, security deposits, clothing for employment, such as uniforms, work boots. Those are some examples. I'll be listing more on the website in the upcoming weeks. One of the other questions on the ATP survey were what obstacles have kept you from getting the needed services to ATP clients? One of the obstacles that one of the providers stated was the time that it takes to be reimbursed for services. Real-time ability to fund recovery support needs. Many clients have needs that are urgent and time-sensitive, but sometimes it takes a while to work out that process and to get reimbursed. So the ATM board, maybe needs to keep some of this in mind as they're developing their process and how they're getting money out to their providers. One of the other questions on the survey, what tools or processes were most useful to you in developing your current ATP? And a recurrent theme here was definitely communication. Communication between the courts, the providers, the ATM boards, having regular meetings with these three entities, strong treatment team. Several responses were in regards to regular meetings with the behavioral health providers, the court dockets, anyone involved in serving that ATP client. Coordination, also being able to drug test and provide the needed services as they come up during court. So collaboration and communication were kind of key pieces to providing good services to our ATP clients. And then I'd also like to read one comment, one of the questions: how can the department or your board or court better assist you with ATP? Some of these were open narrative responses. I'd like to just read one. The response was, give the behavioral health facilities guidelines and how the services can be implemented, what qualifies and what doesn't qualify. Our local mental health executive director has been wonderful in answering any questions we have. The program is a life changer. We have had several participants who have literally cried because of the help they've received from this program. It's a great program, and please keep the funding for next fiscal year, which we are for fiscal year 19. So that is my contact information. You can feel free to call or email me at any time. Also listed our ATP webpage, which is that first site there, and then it also gives you directions to go to the website. I would like to open up for question and answers. I would like you to type your questions in. That way we have a record of all the questions and we can respond in writing and post those on our website. So let me take a look at some of these questions. Okay, and I have Chris Nicastro here who's assisting in answering some of the questions. Okay, so hopefully everyone was able to see our slides. If not, again, it will be posted or you can print that out. One question: are ATP funds permitted to be used to pay for reinstatement fees to obtain a driver's license? Yes, that has been approved in the past. Now, you want to work with your ATM boards, to see how much funding. It depends on how many providers are participating, how much funds, and again, these are time-limited recovery supports, but reinstatement fees are one that has been approved in the past. Next question: can the funds pay for past due treatment balances for services rendered? And so rendered a few months ago prior to the client having insurance? No, it would be only current treatment once the client begins the ATP program. Can the money be used prior to July of 2018? As soon as you receive your allocation, you can start using those funds. Can the funds be used to physical healthcare services like some dental work for a participant where access to a provider is not locally available? No, unfortunately, they cannot. It can only be for behavioral health treatment and recovery supports for their substance use disorder. ATP providers are those that met the state requirements and signed the MOU, correct? So the ATM board will have the behavioral health provider sign the MOU, and that provider must be certified by our department. Please define family treatment. So as part of the assessment and treatment plan, if the client is willing and the family to participate with proper releases signed, to participate in family treatment at the behavioral health agency, and it's in regards to their substance use disorder or a co-occurring disorder, then they may engage in treatment, with the family. There isn't necessarily a family treatment definition. It would be individual counseling that potentially includes the family. The next question, who can provide child care services and be paid with these funds? So again, child care services would be with a licensed child care provider, and it would be child care while the client is receiving treatment or attendance at the court. Or possibly if they're going on an interview with a job, but it's not necessarily meant for ongoing child care while they're at work. There are typically other funds that can pay for child care, Title 20 daycare, etc. Our specialized docket courts do their own drug testing. Can ATP money assist with drug screening costs that the courts do if it is client specific? The administrative funds that are given to the dockets could be used for this, or any drug screens that the insurance would not cover, and the treatment team deems it's necessary for more drug screenings than the insurance would potentially. But in that case, the funds go to the provider, not the court. So the provider would assist in the drug screening and then obtain a reimbursement from their allocation from the ATM board. Next question, we cannot help with the college tuition, but can these funds be used to pay for a job training program at a vocational school or a supported employment program? No, not exactly. It doesn't pay for a vocational school. Now, you might pay for like maybe some of the materials needed for the school, those kinds of things. Application fee might be one of those. Okay, next question. Our courts use ISAM, random drug screening process. Can this money be used to assist with cost with this if it is client specific?
No, of course, only administrative dollars can go to the courts.
So for this one, only the court administrative dollars could be used for this piece. And then we can reimburse the treatment provider if the treatment provider is completing the drug screening. Can the money be used for sober support activities such as pottery or yoga? No. Do the boards pay the provider by reimbursement or need to advance payments to them? That is up to the boards. We've seen boards do it either way, but keep in mind one of the feedback or several of the provider feedback on the survey was the timeliness of reimbursement. Can the courts have a contract with the treatment provider to administer drug screens or help with the contract company doing the random selection for drug screening? They could. I mean, it would be up to the court. If they're spending their administrative dollars on that, they can choose to use that however they would like. If it's a provider agency that the ATM board has selected, so it's an ATP provider agency, then those costs could also be reimbursed by the ATM board. But if they're not an ATP provider that has contracted with the ATM board and has signed the MOU, then the board cannot use those funds unless possibly another ATP provider agency contracts with that outside entity and reimburses them that way. Next question. To confirm, the department will be sending out material within the next 2 weeks regarding access to meds. That is correct. We have a memo. It's just going through Medicaid right now, and that will be going out hopefully within the next week that will explain that process. Next question. Is there an department release that is to be used, or do we just add Ohio Department of Mental Health and Addiction Services and OBM to our local release of information? Yes, you would use your own release of information that is compliant with 42 CFR and HIPAA. We do not have a specific release that you would use. It would be the ones that you typically use at your court or the provider agency. Next question. Do you have a specific release of, oh, well, we already answered that one. We do not have a specific release of information. You can use your own as long as it is in compliance with 42 CFR. Next question, who decides whether the request is acceptable? Is this ATM boards? Obviously, there are parameters within legislation as to how ATP funds are used for treatment and recovery supports. We do defer to our ATM boards to make a lot of those decisions based upon those guidelines, but we do and often provide technical assistance to boards and providers and courts in regards to how the funds are utilized. Can a client remain eligible if they are in sustained remission for opiates, but still involved in the drug court specialty docket? So they have to be an active participant in the drug court, have an opioid use disorder or an alcohol use disorder, and be eligible for medication-assisted treatment, which of course they do not have to be on medication-assisted treatment or engage in that type of therapy. However, they do have to be eligible for medication-assisted treatment and have opioid use disorder or alcohol use disorder. Will it pay for GED? On the attachment today, it does list some examples of recovery supports. As far as educational services such as GED testing, which is now called the high school equivalence test, the fee is approximately $120. There are voucher codes, which is on the back of the handout, which is available by contacting one of your local career technical planning districts. There's a website you can go to. The court's allocation funding can pay for all or part of the cost of a GED test. The funds could also pay for the cost of an SAT or ACT test for participants who wish to attend college. And then, as we stated before, unallowable expenses would be, the actual payment for the college or trade school, laptops, etc. Next question. Then reimbursing family members to provide the child care for treatment appointments is not allowed.
Usually not, unless the provider and the court feel that that family member is trustworthy and they're not taking advantage of the system.
Yeah, typically, we like to stay with licensed daycare. However, if the treatment team, including the court, possibly has a relationship with this family member, it's maybe a barrier to this individual getting treatment or attending court or work, and there's no other daycares in the area, or there's wait lists for daycares, then I can see how the court or the provider or even ADA board might make exception and allow a family member to provide child care. Next question. Can money be used for instant drug screens? If the provider does it, yes, it could pay for the instant drug screen.
If not, the court can do it
And
and use their administrative dollars for that.
if the provider cannot do it, then the court could do that and use their administrative dollars. Next question. Can the funds be used to pay the salary of a case manager dedicated to the specialized docket? ATP funds cannot be used for personnel costs in regards to the behavioral health provider. However, the court can use their administrative dollars for personnel costs. So if the court decided to hire that individual and use their administrative dollars, they could. However, it cannot be paid out of the money given to the behavioral health providers. Next question, can the funds be used for clients to obtain gym memberships? No. Next question. Exercise and recreation are important parts of recovery. True. Can gym memberships and exercise classes be appropriate recovery supports? And again, that answer is no. Okay, it looks like that is all the questions. We will be copying these questions with answers. We'll leave it open maybe another 5 minutes if you've thought of some questions, or maybe you want to clarify a question, or if I didn't answer one to your satisfaction, please ask again, or if I didn't answer it correctly or understood what the question was, please go ahead and type the question in again. Is she still on? She got off. Okay, I think we lost audio for 1 second. Hopefully everyone can hear me again. We did have a question just come in. What happens if you do not spend all the funds that were allocated? well, of course, we hope you do spend the funds. However, if you do not spend the funds, they are carried over in a fiscal year. And at this point, we did give out all the allocation in fiscal year 18 here just recently, and those are to be carried over to fiscal year 19. And we want all these funds to be used in fiscal year 19. Another question. If a client asks for SCRAM, can it be covered? No. Unfortunately, we cannot cover those type of devices. Another question. Can funding be used to do a family functioning assessment to determine the effects of substance abuse on parenting and children? That probably would not be an appropriate use of ATP funds. Yeah, it definitely is not a treatment service. It doesn't sound really like a recovery support either. So unfortunately, it sounds like that would not be a use of the ATP funds. Did get another question in. How do boards pay for recovery support services provided by non-certified providers? So the provider could purchase those items such as gas cards, assisting with identification cards. Now, if there is a recovery support that your ATP provider does not provide, that behavioral health provider can contract or subcontract with another provider for that service, and then that behavioral health provider will reimburse the contracted provider. The court can also subcontract with any provider and use their administrative dollars. We've got another question. Can funding be used to transport children to family treatment when family is doing family treatment or family parenting classes like celebrating families? Well, again, transportation costs are an allowable cost, so that would be up to the treatment provider and their clinical judgment on that one. That looks like all the questions. Again, feel free to email, call with any questions that you didn't get the opportunity to ask today or thought about later. It may take a day or two to post this webinar and the PowerPoint on our website. I'd like to thank you for participating in our webinar today. Call me anytime with your questions or email me. I can also come to your county for technical assistance. I'd like to maybe have regional meetings if we can. It'd be hard to get to all the counties we have now in a timely manner, but if we can maybe coordinate regional meetings, a couple people or boards have offered, so I appreciate that. But if you'd like to help coordinate one of those regional meetings, let me know, and we can maybe get those scheduled this summer. Looks like we just got one more question in. The court administrative dollars is 5% of the county's awarded amount. No, and I know that is a little confusing. It's actually 5% of the total ATP funding from the state. And so that 5%, which is $400,000, is divided amongst the courts and the counties based upon your projected client participation in your court. So if you projected to serve 30 in fiscal year 19 and another county projected serving 10, obviously that county that projected serving more clients will get a slightly higher awarded amount for those administrative dollars. Another question? Can you provide the amounts of the court administrative fees by board? Yes, I did send that out a while ago. I can, if you can email, let's see, I think I know who that's from. So I will email your county. If you want to just email me your request, I can make sure I get that to the right county. I have a list of all the counties and what their court administrative fees are per board and court. Some boards have, or counties have more than one court they're working with. That seems to be the end of the questions. All right, again, thank you very much. I am now ending the webinar.